Now, I want to actually talk about another classification of abnormal uterine bleeding, and this classification is based on the timing in the lifetime of the woman. Okay, so this one is say that a woman was having abnormal uterine bleeding in reproductive age. She can have it before the reproductive age. Do you understand? So for the reproductive age, that one is basically, it's a common gynecological issue. Okay, so it's often caused by a lot of things, which we'll get to talk about it, right? So when we say it affects about 30% of women, you should note that statistics. Now, when we say a woman is having this abnormal bleeding in reproductive age, what is the reproductive age? Between the age of 15 to 49. Okay, so she's having heavy menstrual bleeding. Okay, or sometimes she's having bleeding even between the menstruation time. So causes, that's where you have the abbreviation of PALM-COEIN coming in. P stands for polyps, which all of them have made videos on them. If there's any of these conditions that you want to single-handedly know about, you can just comment and I'll drop you the link. P stands for polyps. A stands for adenomyosis. That's where you're having endometrial tissues outside where the endometrium is. Okay. Then Leiomyomas, also known as uterine fibroids. Then sometimes it's due to cancers, or maybe the tissues are overgrowing. That's hyperplasia. Okay. Those are the structural causes. That's physical issues you can see. Then non-structural ones are the ones that maybe they're like systemic complications. You understand? So coagulopathy. If somebody has issues that generally their blood is not clotting quick, it can also lead to uterine bleeding. Ovulatory dysfunctions leading to all those polycystic ovarian syndrome, then thyroid disorders. Okay. The endometrial issues, that's disorders of the endometrial lining, that sometimes is due to a surgery complication, right? Then the N is not yet classified, but you can say there is a cause, but the cause is poorly understood. Okay, so risk factors is it could lead to no menstruation, it could lead to hormonal fluctuations. It can also lead to polycystic ovarian syndrome or thyroid disorders or stress, okay, and all of that. Okay, risk factors. I will actually try to talk about, possible things that could make you easily have it. So you evaluate this from history and physical examination, where you're asking several questions depending on what you're suspecting that is causing it. Pelvic ultrasound. Then for the lab, you have to measure all the important hormones to a woman. Okay, they do endometrial biopsy if there's hyperplasia and you're suspecting for cancer. Okay, complete blood counts because the person has been losing blood because of too much bleeding, so you want to rule out anemia. So management, if some hormones are missing or decreased, you might actually want to replace. Okay, if there's inflammation, you give non-steroidal anti-inflammatory drugs, and all of that. Surgical options is endometrial ablation, hysteroscopy, where you take out polyps and fibroids, then hysterectomy. Okay, in cases where it's just coming back and coming back and coming back.